I'm Patty Williams-Downs, CEO and founder of Breaking Bounds Enterprises. Welcome back to another episode of the Boundary Breakers podcast, where we share the stories of boundary breakers that are using their unique gifts and talents to transform the world. So please join me in welcoming Systems Director of Global Patient Services and Platinum Program, Medical Fluency Advocate and Boundary Breaker, Erin Mulpur.
Thank you so much, Patty. I'm so excited to be here today.
Yes, I'm so excited to have you. So let's jump in. Tell our audience, who are you and what do you currently do?
So I am a bridge builder. And like you mentioned, I'm in a system director role at Houston Methodist Hospital. And a part of that role involves caring for human beings and caring for them when they're in a very difficult situation. It could be a medical emergency, or maybe they have a diagnosis that they weren't expecting. And we all know that no one enjoys coming to a hospital for care. So typically you're coming to our hospital because you have something that you need to get addressed, and you may feel afraid, you may feel scared, you may not know what the next path is going to be. And so a part of what we do that I love and I'm so passionate about is we care for all the international patients who travel around the world for care at our hospital. And, Houston Methodist is number one in our state, but we also have this amazing Texas Medical Center. And so our international program is one of the largest in the nation. So we have the pleasure of caring for those patients.
That's so awesome. I was going to ask you, what types of cases does your team take on?
Yeah, so we take care of neurosurgery cases, we take care of cancer patients, of transplant patients, really, I would say, high acuity cases where maybe that person was unable to receive that care in their home country, so they're leaving their home country for care and coming to the United States for care. So that's obviously very scary, it's unknown, and the team that I have the pleasure of working with every single day, they are fluent in medical terminology. They speak multiple different languages because they want to provide care to patients where they understand the care that they're receiving. Yeah. And it's just a delight to be able to work with the group of people I work with every day.
So I know that you work in healthcare, but in your description of what you do, I've heard you mention the word care several times, and it sounds like that's really important to you.
Yes.
So boundary breakers are really clear on their origin story and what has inspired them. So bring us back, right? Bring us back. Where were you raised? How did that influence how you show up in the world?
Yes. So I grew up in Montana, and I grew up on a reservation, and that is not, I think, a common experience for many people who live in the United States. And so a reservation is a sovereign nation within a nation, and so there were tribal police and state police and all sorts of jurisdictional things that happened. And so a part of my passion and my origin is, my father was the CEO of a hospital on that reservation. So when you think about things that impact communities, and when you think about just the time that I grew up on that reservation, it was, Montana was the fourth poorest state in the nation, and I was in the fourth poorest county in the fourth poorest state. And so our community struggled with things like domestic violence and addiction and suicide and just things that can be really, really challenging. And so because of my dad's role at the hospital, I really wanted to work at that hospital. I was passionate about that. And I went to the CNO at the time, the chief nursing officer, and I asked her if I could get a role at the hospital.
How old are you at this?
High school.
Okay.
Very
wow.
young, like early on.
Okay.
And she said, "Yeah, sure." And so I asked her, what's the biggest need that you have? And at that time, it was in environmental services. And so I started working in environmental services and cleaning in the emergency rooms and cleaning in the ORs in the evening. It was the night shift. And that's where I really saw firsthand the things that our community was being faced with. And that made me feel it created this sense in me that I am so slow to judge others because there is so much that is happening in our population, in our community, that impacts the health of human beings. And so judging people at face value is not the appropriate approach. There's so much that's going on that impacts that human being. And that's really what I think kind of shaped me at an early age.
Yeah, that's really powerful. That one that you were super proactive at a young age and saying definitive, let's go. And the conditions in the environment. And it sounds like you probably had many different experiences within that role. And we know that, boundary breakers, we have a set of experiences or one that really shapes like who we are and why we show up on, a long pathway in our journey. In that role, did you have an experience or sets of experiences that really shaped why you serve the way you do now?
So I would say in that role in Montana, that taught me the most about others. And fast forward, I moved into a role in Uganda. When I've shared this experience before, it can bring about a wide range of feelings and emotions in individuals. So I want to give that disclaimer. And I also want to say that the intention behind sharing this story is not to exploit any human being's suffering at all. So it comes from a place of, I want to help. I want to help. And I know at times that the desire to help is not the same as helping. So I understand that. So the experience that really has taught me the most about myself and has shaped me really for the rest of my life is I took a medical internship in Uganda. At that time, it was after college, and I wanted to be a physician. I read the book by Paul Farmer, or about Paul Farmer, and I was like, I am ready to go and be a physician in another country and help people. And I just thought he was the most amazing person, the most amazing role model for all the work he's done around the world, and in Haiti in particular. And so I took this medical internship in Uganda at a government-run hospital. And a part of that medical internship was working in the pediatric ward, but also in the maternity ward. And so I was partnered with a physician that would provide cesarean sections for women who were unable to birth. And so I assisted him in the operating room. And there was one case in particular where a part of my role was to always resuscitate the babies after they were born. He would hand me the baby, and I would go and I would resuscitate that child. Mm-hmm. And so I know this is probably sounding very crazy, so I have to provide context that, at this hospital, there were no scales. So we couldn't weigh the mom and know how much she weighed prior to giving her anesthesia to put her under.
Got it. Okay.
So that's important. So we were guessing on how much anesthesia, and they would be completely knocked out. So the babies would be drugged. The babies would be really, really loopy. And so it was always necessary to resuscitate in order to make the babies breathe. So there was this one baby in particular that as soon as he handed me the baby, we all realized in the operating room that this baby was really unwell. The baby had hydrocephalus, so its brain was swollen, its forehead was very swollen, and had spina bifida, so a part of the spine protruding from the back in a sac. Because again, in other parts of the world, mothers don't have access to care prior to screening, right. All of those things that are just vital to the health of a community. So the men in the operating room told me, they said, don't resuscitate that child. Don't resuscitate that child. Like, just let this go. It will be easier on everyone if that child is not resuscitated. And I just couldn't. I just couldn't. It was this human life in my hand. I just saw it as a human being that was vulnerable, that needed safety and protection. And I just couldn't not do that. And so we got into a huge argument in the operating room, and I refused direct orders, and I resuscitated the child. And the child started breathing, and I was relieved. And the mom was still not awake, and so they had to take her back into her bed to let her wake up. And so I brought the baby girl to her dad that was waiting outside the operating room, and I was really excited. And I saw the dad's face, and he was absolutely mortified. And he did not take the baby from my arms, and he walked away from me. I felt like, oh my gosh, what have I done? What have I done? Like, in the United States, we have EMTALA law, we have do no harm, we have consents that are signed by parents, and before there's care given to their children, we have all of this infrastructure. And I am in another culture, and I am applying my infrastructure on another culture. So I felt torn. I felt so disappointed in myself, and so disappointed in like what kind of life that child was going to have. Like, I made that split-second decision to refuse orders, and now there's this outcome that impacts another human life. So later, when the mom woke up, I had talked with the other nurses in the maternity ward, and they took the baby and they presented the baby to the mother. And when I visited her later, I felt just an essence of glowing and of light and of love. Like, she saw the baby the way that I saw the baby, even more. I mean, she's the mother. And that made me feel like, okay, maybe there is hope. Maybe there's hope. Maybe I didn't do something wrong, but I still felt so tormented, so tormented. And I was never invited into the operating room again. I had not been obedient. I had not followed the rules. I had gone against the orders. And I had a great relationship with the physician that I worked with. And we still work together through that experience, but it was forever different. And I knew it, and he knew it. And I told him, I'm like, I am so sorry. I couldn't not.
Talk to us a little bit more about why you couldn't not do that. I know that there are practices that you probably have been more familiar with in the States, but tell us more about what was inside of you. I know that you've also talked about just parts of your identity and parts of what was also a part of why you decided to make that decision.
So I have two core values, one that is around safety and one that's around belonging. And it was against all the fibers of my being to feel like I was in a position to act for someone who was unsafe, that child wouldn't have been drugged had we not given medication to the mom, had the scales been there, had the medication been right. And belonging, a place of like, everyone belongs. It doesn't matter your ability, it doesn't matter what you're capable of, you belong. And I couldn't. I couldn't fight. I couldn't not do that.
Yeah. So what lessons, because this sounds like a really pivotal experience that it almost sounds like you're remembering it as if it were yesterday.
Yes, I feel it. I mean, I can feel it in my body right now, that experience.
Yeah, I can feel it as you're talking through it, and it's probably very reticent for you now. Mm-hmm. What lessons did you take away from that experience that you apply now in your leadership?
After I finished my medical internship, I ended up coming back into the country with other graduate students for their public health practicum. And so we were able to connect many years later, like 6 or 7 years later, I was able to connect with him. And we were grabbing coffee, and he told me, he's like, Erin, I know you've been torturing yourself about this experience. And he's like, I have learned also from that experience, because I learned about how you felt so strongly in that position. And he shared that the mother ended up getting help for the child in a spina bifida clinic in Bali. Not that it's a perfect ending or anything like that, but just that the mom pursued care for the child. And that gave me a little bit of a sense of relief. It still didn't take away the fact that, I have impacted this family's life. But what I have learned from that experience that I try to take with me in really every decision that I make is there really is the desire to help, like I said before, is not the same as helping. You may think you're doing what's right, and if you are not including everyone around the table and decisions being made, you can actually be doing harm. And so I think that that's not something that we recognize as a culture and as a community, that when all voices aren't heard, that means that voices are excluded and that harm can be done.
Yeah, that's powerful. That literally just gave me chills. And I think it harkens back to what you were saying you so deeply believed in, which was belonging. So tell us how you got from that experience to, Houston Methodist. And then, how does that experience impact how you lead in your current role?
Absolutely. So after Uganda, I decided I was not going to be a really great doctor. I'm like, this is not the path for me. So I ended up pursuing a graduate degree in public health, which is absolutely the right path. So looking at the root cause of issues that hurt communities and impact a community's health. And so I got my graduate degree and worked in different capacities in different healthcare organizations and found myself at Houston Methodist 10 years ago and in their global division, so in the global healthcare services part of Houston Methodist Hospital. And that is my calling. Helping patients and working with a team that helps patients who are limited English proficient. So when you think about it, we're having this conversation in English, right?
Yeah.
But our Houston community speaks over 90 languages here.
Yeah.
And that doesn't capture even the amount of languages that are spoken internationally. And so when we set ourselves up for just English-focused work and just English-only speaking, that inevitably excludes non-English speakers.
Yeah. Yep.
So a part of the Civil Rights Act of 1964 covers, in Title VI, it covers that that limited English proficient persons are protected under that law. That it is a group of individuals that deserve the right to receive the care in their language that they understand. So a part of what we do at our hospital is we provide care to patients in their native language.
Yeah.
And that has really helped kind of me come full circle about trying to make sure that we are having that value of safety, that you understand the care that you're receiving, but also that you have an equal voice and representing yourself, that you belong and that you can share and you can speak with your physician that may only be English speaking, but your voice still matters and it's still heard.
Title VI of the Civil Rights Act of 1964 prohibits discrimination on the basis of race, color, and national origin in programs and activities receiving federal assistance. In 1963, before the passage of the Civil Rights Act, President John F. Kennedy stated, "Simple justice requires that public funds, to which all taxpayers of all races contribute, not be spent in any fashion which encourages, entrenches, subsidizes, or results in racial discrimination." Prior to the passing of Title VI, the education experience of students was almost completely predetermined by their race, color, and national origin by Jim Crow laws. Hospitals that received substantial federal funding discriminated against both patients and medical staff based on the color of their skin. courts applied inconsistencies and biases in their rulings that made it nearly impossible to hold those in power accountable for creating and upholding systems of inequity. Today, hospitals like Houston Methodist are leading the charge in normalizing global, inclusive care by embracing the principles of Title VI through everyday operations, by building global teams that are responsible for providing free language assistance to patients with limited English proficiency or other special communication needs, creating multilingual materials to ensure all patients understand their rights and the types of care provided to them, administering cultural competency training in their health professional education, and recruiting bilingual clinicians who are familiar with their patients' culture and heritage. It's just as boundary breaker Erin Mulpur says, when all voices aren't heard, that means that voices are excluded and harm can be done.
How does your team facilitate that? Like almost like the practice, because that comes from leadership, right? Like the policy can be a policy.
Yes,
it doesn't mean
yes.
that it's a practice.
Absolutely.
So how do you create that for your team where you all are practicing that accessibility through language as a way to create belonging?
Absolutely. So many of my staff come from different countries around the world. So when you walk into my department, you probably feel like you are walking into the United Nations. You know, there are staff from over 30 different countries, and the main languages that our patients speak are Arabic and Spanish. So we have a predominantly Arabic and Spanish speaking staff that care for those patients. So they understand the culture. They understand the patient's language. They're able to advocate for them, and they participate in the care from start to finish, prior to the patient's arrival and even upon discharge when that patient returns home. And that is a part of helping a human feel valued, seen, and heard, that you don't choose your healthcare diagnosis. You don't choose to be ill, that happens to your body and it's scary, and that we want to walk alongside you and help you through that experience.
Yeah. And it doesn't just, your care just doesn't end while you're in the institution of a hospital.
Right.
Right. And you're saying, actually, you're going to have an experience outside of this, and it is also our responsibility to provide accessibility there as well.
Yes.
So with each boundary breaker's story, there's hope, which it sounds like you have been able to carry in to your practice now. And there's still loneliness, right? Because you're still breaking barriers that exist and even trying to create belonging. And you're taking deep breaths, so you know where I'm going to go.
Yes.
What barriers present themselves as you are trying to create literal systems of belonging?
So, in moving into my role, you get to see, you move into your leadership position, and you look under the hood, and I was looking at the data, I was looking under the hood, I was sitting down with the team that was in place, and it wasn't representing the culture that we want.
Okay.
So, we have a strong, what I'm going to call an I care culture at our organization. So integrity, compassion, accountability, respect, and excellence. And a part of that woven in is being unparalleled. And looking at what I looked at, I was like, this is not unparalleled, but we can get there. We can get there, but it means that there's going to be changes. And changes can be painful for people. So I didn't necessarily have the right team in place. So a lot of decisions had to be made about getting the right team in place. There's grief around that.
That's hard, yeah.
And when things are going well, people also don't want to change.
Yeah.
But that layer of unparalleled is what it's like, well is not unparalleled. So we have opportunity. So meeting with the staff and getting them around the table on how to get ourselves to unparalleled, that was an undertaking. And it was lonely at times. I was not well liked at times. And there was a leader within the organization that recommended a book to me that was called like How to Rock the Boat and like not fall out or something. It was like, And I'm like, I know I am. I'm rocking a lot of things right now. But fast forward, I mean, I'm at this organization. I'm so valued. I have amazing leadership support, amazing executives across our system.
Yeah.
And
tell us how you got people to change when change was hard.
It takes time, right? A culture shift, a mindset shift does not occur overnight. And so it takes a tremendous amount of persistence, and it requires a tremendous amount of communication. Communication all the way down to the person who welcomes our patients at the front desk, and all the way up to our executive CEO. So that communication is so, so important in order to create that alignment and create a united persistence. So after we gained a little bit of that momentum, COVID hit. And that really shook us. And when you think about COVID, you think about, hospitals around the country, around the world were being just dramatically impacted by that. Mm-hmm. And there was limited personal protective equipment. I'm like, does everyone remember that we had to wear masks? Does everyone remember that there was a limited supply in personal protective equipment? Did everyone remember that there was issues with getting people vaccinated? Like, that feels so recent to me. And so because of the different waves that were crashing against our organization, my in-person interpreter team that provided in-person interpretation could no longer be present in the room with the patient.
Okay.
And that's very difficult.
Yeah.
That's very difficult because the patient still needs a voice.
Right.
How do we provide that patient a voice when we don't have enough personal protective equipment for our interpreter to also enter into the room? So we ended up creating an integration with our technology where a nurse with a Vocera device that's kind of like a walkie-talkie that was all donned in PPE would be able to go in and talk with the patient and push on the Vocera and say, please call language assistance. Okay. And it would be Spanish, or it would be Arabic, or it would be Vietnamese. And we were able to bridge that into our over-the-phone interpretation technology. And through that innovation and through that technology, we actually were published in a journal.
Oh, yeah.
The Journal of Immigrant and Minority Health. And that recognition across the nation really started creating this excitement with the staff on what I do matters greatly. This is so important. This is a civil right for patients. This is a part of the Civil Rights Act, and it's Title VI. I mean, it's written there very clearly. So that white paper ended up getting acknowledged by a podcast in Australia. And so just this past year, I was asked to sit on that podcast. Yeah. And what I learned is that this paper actually created a ripple into this Australian system of we should look at how we protect our citizens.
Global influence.
Yes,
yeah.
We should look at how we protect our patients who come to our hospital for care that don't speak English as well, because there's so many diverse languages spoken in Australia.
Right.
So
that was exciting.
Yes. So that momentum, that positivity, that persistence, that growth that was created, and having the right team in place, that really helped us get to where we are today.
So it sounds like in your role, and honestly within a global pandemic, which is everyone was challenged with that, presented a new challenge for you to apply your values of care and belonging, to apply measures of ensuring that people can be safe and cared for. And it sounds like it's created this global awareness of systems that you can use to be more supportive of patient care, which I know I can literally feel the beaming pride coming off of you, and that's incredible. So congratulations.
Thank you.
I want to shift to how you have, what you have learned in your leadership journey and how you have been able to port that to your external work, essentially with patients and clients, to how you have also learned lessons and pivoted in supporting your staff with your values. You and I have spoken before, and you've learned a lot about the idea and juxtaposition around what you were describing, which is there's a difference between desiring to help and actually helping. So tell us a little bit more how that shows up for you as a leader and a manager.
Yes, absolutely. It means that everyone needs a seat at the table, no matter what level they're at, no matter what title, no matter what language, no matter what religion, no matter what culture, what country, everyone has a seat at the table. So a part of that is spending a lot of time listening. And I try to avoid talking, but it is difficult for me at times, especially when I'm passionate. So I would say that has been really critical. And sometimes those listening sessions are in a large audience, but sometimes listening needs to be behind closed doors and giving them the space.
If you're thinking aspirationally and you're saying, I wish, what world do you envision in the healthcare system?
Oh my goodness. Well, I feel that Houston Methodist Hospital is amazing. It is an amazing place to work. There's amazing care that's being provided for patients. But what I think I do and what I think we do, it is outside those four walls, right? Around safety and belonging. And so if we know in our world today, not all people are safe. We know not all people feel like they belong, or not all people belong. So the work is never done. But when you think about going outside the walls, like taking our eye care values outside the walls of our hospital, it means more dialogue and discussion between opposing viewpoints. It means that we don't always have to agree, but there's still respect. It means that those individuals that right now are feeling unsafe and feeling like they're being excluded, that the sun is shining a little bit more brightly on their faces and it feels warmer. That's the world I want, and that's the world I know we can have, but it's just these little drops of water that are those ripple effects of goodness and kindness and compassion and belonging and safety and understanding, and together, those ripples make waves.
Yeah. So last question to round us out is, what advice would you give someone taking a pathway into the healthcare industry? You know, there's a multitude of directions that they could take.
Yes.
But so we're not necessarily speaking about a job per se.
Right.
But what advice would you give them?
Well, I think as leaders, it is so easy to get wrapped up in the hustle and the bustle and the fires and the conflict and the problems. It's so easy. And I have definitely struggled with that historically. I would say for anyone wanting to move into a role with any kind of leadership role in any industry is allow yourself to get still enough to hear your inner voice.
And why is that important?
I would not have discovered that my core value is safety and belonging if I didn't get quiet and listen.
Yeah. Well, I am so grateful that we will have so many people that get a chance to listen to your story. Because it's so impactful and it's so authentic and genuine. And we're so grateful to have you on our show.
Thank you so much, Patty.
For being here.
Thank you. Thank you.
Thank you. And that's another episode of the Boundary Breakers podcast, where we are amplifying the voices of leaders who are transforming the world through their unique gifts and talents. As you have heard, boundary breakers rarely get there alone. If you are a current or aspiring executive seeking to enact meaningful change in your organization and the world, visit our website and learn more about Boundary Breakers strategy consulting and executive coaching services.
Or if you believe you fit the profile of a boundary breaker with a message that has the potential to inspire our listeners, share your story with us through the email address in the description. Finally, don't forget to like and subscribe to be the first to know when the new episodes are uploaded. Until then, continue breaking boundaries.